first speaker for the day. Um, it is my honor to introduce you to Dr. Robin Nielsen, the Dean College of Nursing and Professor of West Coast University in California, USA. Dr. Nielsen has been the Dean of the West Coast University of College of Nursing, a private health sciences university, for almost 10 years. She provides nursing leadership in conjunction with the campus nursing team for the five WCU campuses in 3 states, comprised of over 6,200 clinical nursing students in the BSN program, 144 full-time faculty, and over 725 adjunct faculty. She has taught at the BS, MS, and doctoral level at several educational institutions, including California State University, Sacramento, part of the respected California State University system, where she served as chair of the Division of Nursing before accepting a role as the Dean of the College of Health and Human Services at Touro University in Nevada. As Dean at Touro University, Dr. Nielsen was responsible for leading the schools of education, nursing, occupational therapy, and physical therapy. Dr. Nielsen is a site visitor for the regional accreditor WASC, Senior College and University Commission, and for the Commission on Collegiate Nursing Education. She has over 25 years of experience teaching NCLEX review classes, is co-author of Davis's NCLEX RN Success, 3rd edition, and has served as a curriculum consultant to 8 universities in several states. Dr. Nielsen serves as the Education Board Member for the ANA California, Board Member of the CA Association of Colleges of Nursing, Chair of the American Association of Colleges of Nursing Faculty Development Conference, and Faculty Consultant to the CA Nursing Students Association. Dr. Nielsen earned her Bachelor's of Science in Nursing from Loma Linda University, her Master of Science in Nursing from Boston University, and her PhD in Nursing Administration from the University of California at San Francisco. When describing her view of leadership, Dr. Nielsen remarked, "Life is full of challenges and opportunities rather than threats and harm. If we support our colleagues and the students who trust us with their futures, those challenges and opportunities consistently bring great success." Welcome, Dr. Nielsen.
No wonder I'm tired. So anyway, thank you very much. And I thought I had given a more abbreviated introduction, but obviously you got a hold of a different version than I thought I had sent. Anyway, well, let me before we do anything, I mean, and thank you to Tariq for meeting with me the other night so I could, navigate some of this technology. So I'm going to go ahead and upload. I know exactly how Deborah is feeling. This is very, and let's see, I guess I need to share my screen probably first, don't I, Tariq? He's sitting there thinking, oh my gosh, this technology is going to do us all in. And I feel like I'm sort of a pilot taking off in my plane with my headset, but I find I think the audio is always better. Okay, I'm sharing my screen. Are you able to see my PowerPoint? Nod? Oh, wonderful. Oh, success. Anyway.
So
Okay.
Dr.
Well,
Dr. Nielsen, would you please go to the display and choose the first option in the top?
Oh, show taskbar?
No, the second one.
The display settings,
Yes,
and you want me to move it? You want me to swap?
correct.
He gave me those instructions the other night. I just
That is
probably
good.
didn't pay attention.
Awesome.
There we go. Well, we're ready to roll. Anyway, I do want to welcome all of you back today and thank you for the opportunity to share this most challenging year in my professional career. And I thought a lot last night about the presentations that we heard, and my colleague, Dr. Tarver, has me really sort of concerned because she said I can't multitask, and I don't know how in the world I will get through the working from home and remotely and but she said only computers multitask. Thank you very much, Chris. You've just gave me a sleepless night. No, I'm kidding. Anyway, but I have been in higher education, and I shouldn't tell you because I don't want this to get out, but almost 48 years. But I tell my students and my faculty, I'm only 39. So I want to leave you with that, even though it's been, some of you probably weren't even born, particularly a beer. Anyway, and the traditional modality, and, we're going to hear from Dr. LaVille shortly about the different types of ways that we've, are teaching. But the traditional modality, I was trying to get an image in my face, or in my head. I said, I don't have COVID, but I have COVID brain. Anyhow, I was trying to get this image in my head. Faculty at the front of the class, students on the edge of their chair waiting for new insights. You're kidding yourself if you think that that's what they're doing in this day and age. But more recently, we do have active learning strategies where the faculty moves about the room. That's been a real challenge for them, and engaging the students. But in 2020, that was not the case. We were not even in the classroom or the hospital when the pandemic hit. So next slide here. So in March 2020, when over 65% of the clinical rotations in our BSN program were canceled due to COVID-19. That's what education faced. And for me, 75% was over 1,300 students that could not go to the clinical area. Now, it's being reported that in 2020, telehealth and telenursing progressed. They took a leap by about 5 years in terms of technology, enabling the care of the whole person. And I don't know if those of you in California have been following some of the waivers, but you can do telenursing with your pet now. So, I mean, it's not just for, us as people, but prior to April 2020, telehealth was only about 10% of the healthcare visits, probably due to proximity or access, of course, to the client. And it went as high as 60% of the way that patients sought care from their providers. It has leveled off in December 2020 at about 19 to 20%, but that's still double of what it was in, before the pandemic. So I'm going to share with you our academic experience with telehealth and telenursing. So in addition to having no clinicals for over 1,300 students, our faculty had to go into teaching their theory courses online. And I mean, I'm not a native. I'm an immigrant to technology, and you can imagine a number of my faculty are also. So not only did we have to change the way we delivered our theory, we now had our students saying, so what are we supposed to do in order to learn? And we also were faced with the Board of Registered Nursing, particularly, this is California I'm speaking to because my campus is in Texas and Florida. Their boards had different ways to deal with this, but our regulations said we had to have 75% of our clinical hours in direct care. How is that possible with the clinical displacement that we were looking at in March of 2020? And we understood why our clinical partners, had to displace the students. You heard Dr. Gerard yesterday talk about how, Cedars-Sinai had to gear up to care, and the same Dr. Tarver at City of Hope. They had to get ready to take care of the patients that were going to be coming in. And, students were, could be a helping hands. They are now, and we're going back, but they had to get ready, and they didn't need the new graduate, or not the new graduate, but the student saying, what? Why? So anyway, we had to look at how could we meet our clinical obligation. And the Board of Nursing did, in response to the clinical displacement, reduced it to 50%. Wow, we still did not have hospitals in which we could go into. So they did permit volunteer experiences and wellness calls. also known as telehealth or telenursing. That really, really was our survival in order to keep our students progressing and graduating on time to get out to the workforce and to be able to help our clinical partners. This is the image from the flyer that we sent out to our communities and asked, do you want to, would you like to speak with a healthcare professional? I'd like to, obviously I wish I had a quiz, not a quiz, but a poll that I could put up here. And I know that that's, possible, but that's not within my skill set. But how many of you have had a telehealth call with your provider, either before COVID or after or since COVID? I'm a Kaiser member, and I can tell you, I had my probably very first one during COVID, where my healthcare provider just, wanted to check in. And I've noticed that I get a lot more emails, texts from my healthcare provider than I ever did prior to COVID. Not him personally, but from my healthcare system. So, it asks the question, would you benefit? No cost. Educational health discussion. And it says that West Coast was offering these telehealth appointments with nursing faculty and students. Community members of all ages are welcome to call and learn more about the health concerns. And I'm grateful to my colleagues up in Northern California, Cabrillo College and College of Marin, who had already sort of jumped in to using telehealth, telenursing, who just generously provided us with their model. So we literally, from the middle of March to the beginning of April, were able to develop a telenursing program that was approved by our nursing education consultant and met the clinical hours, the direct care hours. And I'm going to tell you a little bit more about that story. I mean, I think some of the things we think of when we talk about who would benefit, there's, obviously behavioral health has been a major use of telenursing and telehealth. It will solve problems, as I will share some of the stories with you. And no surprise, patients are impatient, and the opportunity to get a call back, as long as people return the call, is really helped with them being able to get in or get answers to their needs. So now for the rest of the story. Maybe, why is it not advancing? That's weird. There we go. Wrong button. Helps hit the one. So the questions I want you to think about: what is telehealth or telenursing? And for us, it provided these students an opportunity to learn, but also give back to their community. It's conducted over the phone. It's a great way for the community members to learn about what's important to them and answer their questions without having to leave their house, without having to go to the doctor's office. And we know that a lot of them are very, very concerned about, what was going to be the consequences if they left. Would they be exposed to and this is just a list. I'm not going to read it to you, but what some of the issues that telehealth supports. There are no surprises. There's mental health that I mentioned, or behavioral health. Lots of questions about COVID, and lots of questions about some of the medications that they were on. And I'll share a story with you as to, one of the patients or clients that we encountered. And it covers the age band. It's from the, child to the senior. There were no limits, and we applied the telehealth experience in all of our courses, all the way from beginning med-surg up to our advanced med-surg courses. And it just increased in complexity, and it increased in the critical thinking that students had to do. And I'm hoping, I mean, those of you in academia know we're going into the next generation of NCLEX, and some of you were probably like me, you spent 2 days in a big auditorium and you had 6 booklets, and now it's computer adaptive, and it's going to be going to clinical reasoning and clinical decision making. And I'm thinking this may have helped the students in terms of processing the answers to some of the questions. So what should they expect? We actually want them to, know that we're calling Our faculty did a pre-call, would set up a time that was going to be convenient for them. The professor and the students would have gathered information about what are you concerned about? What is it that you want to learn about? Obviously, if you remember when you were in nursing school, I mean, you went into the hospital, and as we've gone over the years in education, we've done, preparation. We pick our patients the night before. Well, we had to kind of give the students a little heads up about what were going to be some of the questions that they should address with their client, and they'd be ready to share with them everything. And trust me, students had gone to the nth degree to make sure they had the information. And then they would, schedule the appointment with them, the call. And then if the client or patient wanted to, they'd call them back in a week or even sooner with additional information. So it was really a very reassuring experience from the people that they talked to. The benefits, I mean, obviously, there's just a lot of opportunities. It connected these nursing professionals, connected the patient, I should say, with nursing professionals and students. It also was a great experience between the faculty and the students. We held like pre-conference, just like you would if you were in the hospital. They all were on Zoom, and they would have their pre-conference, discuss what they're going to talk about. And yes, there was more than one student and one faculty on the call. It would be the whole clinical group that would be on the call, and they would have designated responsibilities. Sometimes when students go into the clinical area, they may not even have as much of an opportunity to do this deep dive into what the patient needed. So I think it was a really a great experience for the students. Well, I'm going to share with you what the learning opportunities were. And I think the one thing that I heard from my faculty is the students really improved on communication. They had to talk. This was a total stranger. Now, is that the case when they go into the hospital? Yes. And I used to teach beginning med surg, and I would go down the hall and I would see the students standing outside the room say, you got to go through the door. The patient is on the other side of this wall and you need to go in and talk to them. Well, this really sort of helped them a little bit of how to break the ice with this total stranger in terms of talking to them on the phone. Again, faculty reported the confidence level of the students really soared, and I love it. They described it as kind of like this aha moment when they were able to, have a little insight into what the patient wanted to talk about, and they were ready with that. And so they were, I loved the idea that the students felt like they were really going to be able to make a difference in this client. The critical thinking, and as I alluded to, that's so important. I mean, yes, they have to have the technical skills, but it's the critical thinking process that is going to make a difference sometimes in saving the life of a patient. And the student provides the answers. They had done their homework. They were ready to go. It also exposed them to multiple ways to solve problems. There's not just one recipe, but they were able to, in their research of the literature and trying to find answers, they came across many, many different ways to solve the patient's problems. They also found that they were able to address hesitancies. Sometimes the patients were reluctant to bring up concerns. And so I think they felt a little bit safer. It wasn't anonymous, but it wasn't like we were going to, write down things. The patients were assured that it was confidence. We obviously had the name of their provider, and we could reach out to the provider if we felt that there was an issue. And I can think of one situation where a teenager sort of voiced concern about, wanting to commit suicide. They had the contact, they could intervene, but they really, could address what was bothering the patient. Why was the patient hesitant? As I mentioned, we treated, we had like pre-conference and we had, post-conference, and they treated it a lot like a shift report. What would you report off to the next shift in terms of what you heard, what you saw, if it was on Zoom? Sometimes it was just telephone, but a lot of times people had access to the the video and they could see them. So I thought, you know, it was a good experience in getting ready to what are you going to share with your colleagues. Faculty and students really, really found there was teamwork in this process. They were all sharing in it, and it would be like, you know, you're going to be ready to answer this question, you have a backup for another solution, and they worked as a team to provide this very rich experience. And you know what? It was really realistic experience. You might think, you know, how in the world did that meet the direct care experience? But again, when you go in, the students go into the hospital, they often don't have this time, and sometimes the calls could be an hour. In terms of talking, you don't have that luxury when you're in the clinical setting, and it really gave them a very realistic opportunity that they might be quicker to add. I feel at this point, I want to mention I'm a Rotarian. And when I think about this, you know, the opportunity, my Rotary have number of my members have stepped up to the plate, and they have the students call them, and they have legit, we're not making anything up, but they have legitimate health problems, but they will term after term let a new group of students call them. And it's been kind of fun because they're having a contest to see who gets called the most times by the nursing students. And I, you know, so the community is enjoying this contact with the future of healthcare, you know, our students. They learned how to put a stranger at ease. You know, if somebody's, and I'll share a couple stories with you shortly about how some of the people, you could tell that they were quite concerned, impatient, as I mentioned. Well, they learned how to put them at ease, and the faculty member was there so that they could sort of help them. And they always, you know, left the call on an uplifting note. Never anything. It was like, you know, we'll get back to you next week with some new information, and we're here if you need to contact us before, you know how to reach out. And they really, the faculty saw the creativity and the engagement that resulted from this telehealth, telenursing experience. I mean, it was something that I'm very grateful to the pandemic and the clinical displacements to give my students this opportunity. Well, I would be kidding you as there, if I thought there were no challenges to that. And yeah, as the slides, my daughter's a graphic designer. She always tells me my PowerPoint presentations are terrible. So she redoes them and puts in her own delivery. So I'm sorry, these all bounced in at once. But I think the number one problem was sourcing clients and patients. You know, we needed to have a provider. We needed ideally to partner with a clinical agency. We did partner with some community groups who wanted wellness calls made to their subjects. That was, you know, the number one challenge, to have enough for all the students, 1,300 of them, and that's just in you know, that was primarily in California, that, you know, be able to have enough clients for them to call back week after week when they were not able to be in the clinical area. We did hire, or employ, I should say, we didn't hire, employed a translator. So you need to have a translator when you're calling, particularly in, you know, Southern California, to be able to, you know, translate and still continue to provide that education to all of the people in the community. Also having age appropriate topics, because of pediatrics, you really had to think about, again, some of it was doing the pre-work, so they were ready to bring up topics. It's just like with any situation, and I'm sure, you know, Dr. Hedges, you know, is thinking, oh my gosh, what questions are we going to ask? We have to have some ready. Well, it's the same thing when you're dealing with children. What are some of the topics you might want to bring up to them in case they don't ask any questions? We had to, you know, precept new course faculty. This was a new way of doing what they were accustomed to. And I have a lot of adjunct faculty who only do clinical. All of a sudden now they were in, you know, a different setting they work. So we had to get them on board. The pre-work, as I mentioned, what might the patient ask, or to have some topics ready to go based on the age of the person and any information that they may have given. What do you do with a client of few words? I mean, you have a call, and, you know, again, be ready, draw up possible questions, and this really helped the students sort of pre-think what would be the topics that they want to be sure the client or patient was really clear on. What about complaining? This became, could become an audience for complaining. They've tried to get through to their provider. They can't. Aha, they've got a captive audience of nursing students who, might, this would be a good vehicle for complaining. So again, preparing the students for how to redirect the patient's questions, how to get it to a positive experience. And you had to be sure they were invested in the experience. Just like the last bullet says, you can't come late to lecture and you can't be late to the phone call. I mean, you've got to be there. You've made a commitment to the patient, and you have to be sure that you're going to be ready for whatever comes up. So it was, a challenge in some areas, but as I told you before, the opportunities far outweigh the challenges. Now I want to just share with you some stories, and I hope that Jose, you'll let me, you'll give me the hook, because it's hard for me to watch the time, and I can see the clock ticking up there, and I'm not exactly sure when.
Yeah, Doctor, you still have time.
Okay, super. Anyway, I think this is kind of a classic story for Southern California. It was a Spanish-speaking client. She wanted to know how she should talk to her provider. I thought that was interesting because she had questions about her medications, and she began to cry, on the call. Of course, that, all of us would become a little, uneasy and disconcerted about why she's crying. But to make it worse, the translator dropped off the call. And so the faculty tried to call the patient back on the faculty's cell phone, and that got disconnected. So they scrambled to get back on the call. And the faculty member said it was his time to shine and speak Spanish, but he wasn't fluent in Spanish. So he said, between a mixed combination, I guess we call it Spanglish, no offense, but I mean, it's a mixture of Spanish and English, that he was able to calm the client down. And she was very grateful that they persisted in getting back to her. And he said to me the lessons he learned: he had to perfect his Spanish, number one, and he was going to change his cell phone carrier, because that did not work out well to have it dropped in the middle of this very important call. So in the midst of this, they calmed the patient. She was grateful, and there was a little bit of humor in it. Now, here's a response from a client that they were saying that the patient was complaining of dizzy spells, and for 6 months. And the students let her know her medication might be the reason. And they recommended that she discuss this with her provider. And she said the provider discontinued the medication, which she didn't really need, and the symptoms went away. And so, that's the kind of response you want. But they could, they followed up with her. Obviously, it didn't go away on the call, but they followed up to see if she had talked to her provider. They gave her the confidence that she needed to what to ask when she reached out to her provider. This is probably one of my favorite, and those in academia are going to appreciate this. The students, the faculty reports, the beginning med-surg students had met with a client who had many, many, many questions and was very, very anxious. And after they were listening to the client, they'd written down 20 questions that the client had asked by the end of the call. Now, this is the funny part of it, is the students want to know if this was a fake patient, because it felt to them like SimLab, because in SimLab, we give them anything and everything that could possibly go wrong. And I thought, bless the students, but this is the kind of patient. This was a very anxious patient who needed to talk to them. And so the faculty told the students, as nurses, they'll meet every type of patient: sick, elderly, young. and different types of mental health. And in this case, they had to decide how in the world were they going to address the needs of this particular client. And I guess, you know, although that was sort of, I found humor in them relating it to the fakeness of a simulation situation. I also thought this was an important takeaway, and it was important not to rush to judgment when they were talking to the clients. So this was a young 20-something, unemployed, going back to school for his master's degree in public health. And, you know, this sounds like the one I mentioned, that this would be an opportunity for them to complain. And he was complaining about his last medical experience. And so the faculty shared with the students how a telehealth call can spot a problem. But the faculty told him it was important to work on trying, you know, to fix the problem, to leave that patient, that client, feeling a little bit more comfortable. And so the telehealth was able to reinforce the importance of listening and to work with the client to find a positive solution, not rush to judgment that this was somebody that was, you know, not really doing well, but just needed a little extra time and attention. Have put in this presentation here, and maybe I could ask, you know, Dr. Hedges or, you know, to put this link in the chat, because I can't type and talk at the same time. But this is the California Telehealth Resource Center. It obviously, it's open to everybody. And if those of you that are, you know, interested in maybe starting a telehealth, experience, this has everything that you could possibly want about how to set up telehealth in your academic program. But those are my academic colleagues. Please don't hesitate to reach out, because I'll share with you, just like Cabrillo and College of Marin did, if you want to integrate this in any more depth. Now look at these faces. How could you not want to provide them with an opportunity? Obviously, Professor Nakamura is a faculty member, but this was taken after one of their telehealth calls. I mean, they are so excited about the process and the experience. And I don't know, I plan that even though we're still relying heavily on telenursing, but we are being able to return as the infection rates drop. And as I think you heard Dr. Gerard say, just, you know, the number of patients in the hospitals with COVID, and the senior students, they're a great resource. And so they're going back, you know, the hospital clinical partners have invited them back. But I think that telenursing, telehealth needs to be a regular component in the nursing curriculum going forward, not just to be ready for another catastrophe like the pandemic, but there were lessons learned aside from the technical skills that we get in the clinical experience. And I don't think we'll ever, you know, truly be able to provide the students without continuing it. So I just love the smiles. The faculty members sent this to me of her group that had just completed a telenursing call. Makes me feel good. With that, if you have any questions, and I hope I stayed on time. So